Hello, and welcome to the Dr. Money Matters podcast, the show where we discuss important financial topics that were never covered in med school. I'm your host, Dr. Tarang Patel. Welcome to another episode of the Dr. Money Matters podcast. Today's episode is about physician salaries. I talked to Lesley Kane from Medscape about their annual physician salary compensation report and the associated net worth survey as well. Salaries make up the bulk of our overall wealth for most physicians, particularly early on in their career. And there's a couple of issues that I touch on that'll be of interest, specifically the persistent gender gap in physician pay, as well as trends in salaries, whether it's primary care or specialties. We also talk about whether it's okay to discuss publicly physician salaries. I know the majority of the audience for this podcast are physicians or physician spouses, medical students, residents, whatnot. But what about discussing salaries in a forum where it's accessible to the non-physician, the lay public? Do you think that discussing salaries leads to a negative perception of physicians? In my opinion, it may do that, but these numbers are out there. In the day of the internet, it's not too difficult to know what people are making from looking up salaries from government officials to publicly traded companies, whatever. So it doesn't really add much of a negative. And in my mind, there's a big positive about being transparent that will help eliminate the gaps in physician salaries or the discrepancies in physician salaries. But what do you think? Let's talk about it further on the Dr. Money Matters Facebook group. And then the other topic that I thought was interesting, and many of you had commented on it, is the relative low net worth of physicians, particularly those later stage in their careers. Now, some of that could be attributed to lack of financial knowledge, and then also just decreased salaries previously. But quite honestly, physician salaries have not increased significantly over the last 20 to 30 years. And if anything, when accounting for inflation, have probably decreased a bit. Now, we all know no one's going to give you more money unless you ask for it, but hopefully with this podcast and other resources out there, you can arm yourself with a better knowledge and improve your negotiating position. Remember, previous guests talked about negotiation. Previous guests on this podcast talked about negotiation, and as well as an internal medicine physician who was able to 5x his income by making good business decisions, as well as becoming more efficient in his practice. If you haven't listened to those episodes, those are the most recent episodes, episode 39 about negotiation and episodes 37 and 38 about the 5Xing of the internal medicine physician's income. Anyway, let's get on with today's episode about the Medscape Physician Salary Survey and the Physician Net Worth Survey. My guest is Lesley Kane. Okay, welcome to another episode of the Dr. Money Matters podcast. My guest today is Lesley Kane, a senior director for Medscape's Business of Medicine section. It's a platform focused on providing physicians with the practical tools, insights, and information to support them in developing, managing, and building their practice. She leads the direction and development of all the content, services, programs, and surveys focused on the business side of medicine. Lesley, welcome to the podcast.
Thank you. Thanks so much for having me.
Medscape has done a couple of pretty good surveys, and I think you guys do them annually, but they happen to coincide recently. Physician compensation survey, I think, came out in April, and then just a couple of days ago, the physician net worth and debt survey came out, and that one really got members of my Facebook group talking, and I think it's one that we physicians kind of always talk anecdotally to each other, but it's nice to see it formalized. So I'm glad you guys are kind of doing that. And there are several other organizations doing it as well, but I feel like yours is one of the more accessible places to get this information. So I want to thank you guys for doing that.
Great, thanks. I'm glad you liked it. And just to mention that the Wealth and debt survey was also part of the compensation survey. So we got all the information at once, but there was just so much information. We figured let's make it more easily digestible. So we put it into the compensation survey and then separately into wealth and debt.
And there's a lot to go through both parts of this survey. So I think we'll just kind of get right to it. So you guys do this survey annually, and how long have you guys been doing it now?
Oh, this has been going on for about 7 or 8 years, and it's really expanded in scope and just been very interesting and has been quite well received since the start.
7 to 8 years now. What are some of the changes that you guys are seeing during that time?
First of all, income has been trending up pretty much consistently. I think there was 1 year there early on when there was a little flatness, but it's basically been going up. One thing that's very pronounced is the trend to employment versus self-employment. I think in our early studies, about 33% or 33%, 40% of physicians were employed. And now, years later, we're talking about 60%, in some cases 70%. So that's been just climbing astronomically. And a couple things that the specialties that do the best seem to be similar year after year. I mean, they change positions a little bit with each other, but they do stay on top. The one that I thought was really interesting and notable this year was that plastic surgery has done so well. That really soared to the top. And I think there's a lot of societal factors that are leading to that.
Right, I would agree with that. And I'm kind of surprised that it wasn't near the top always, because one one tends to think of plastic surgeons as a high-paying field anyway, and it tends to be, at least the ones who are very well paid tend to be more on the elective side of it. So, but maybe that has something to do with the continued rise of the economy in the last 8-9 years. So, I think you're right. The same fields do tend to kind of dominate at the upper ends of the compensation. But we do see some changes in the middle to the lower ends a little bit. Like I noticed going through that, psychiatry seems to be in pretty significant demand right now. And does that translate into increased salaries for them?
I think this year they did a little better. I don't actually remember. Can't speak to that right now.
Just again, speaking to some of the psychiatrists that I know, they seem to be getting more and more recruitment letters. And I think, in order to fill that, they are getting better starting salaries. But one of the questions, and you kind of alluded to this a little bit, is that we still see a pretty significant difference in salaries in terms of the specialties and some of the surgical specialties, orthopedic surgery, plastic surgery, some of the procedural based fields like GI, radiology, cardiology all tend to dominate at the top ends of the fields, whereas more of the primary care and less procedural based specialties tend to be a little bit lower down. Has the salaries gap at least narrowed over time, or does it seem to be pretty consistent between those ends of the spectrum?
Yes, it's pretty consistent. And I think one of the reasons is that primary care is seeing so many challenges these days. First of all, there are so many lower cost alternatives being promoted. There are video doctors. There are more patients that are seen by nurses and PAs. And there's a lot of pressure in the government and programs to keep the costs down in primary care. So they really have a tough road there. There are a lot of challenges. And so I don't see that gap narrowing really anytime soon between primary care and specialists.
That's been true for a bit of time now. And unfortunately, you're right. It seems to be the continued creeping in by non-physicians at the margins of healthcare, and they're starting more in the primary care fields, but they're working their way up into more advanced procedural fields as well. And so you're right, that pressure is not going to go away. I think a lot of doctors are starting to feel that, and it probably contributes to the continued preponderance of most medical students going into specialties as opposed to primary care. So one of the other things that has been a big topic of conversation, particularly in the last year or two, has been the gender gap in terms of salary. What are you guys seeing in that in terms of your survey?
Well, it's really interesting. First of all, in primary care, the gender gap has closed a small amount. In specialties, not so much. But let me take you through how we looked at this because it's been very instructive and very interesting. So overall, we look at, here's the difference between male physicians and female physicians, and there's a big gap. So then we thought, well, let's look at who's in what specialty, because a lot of times it looks like more women are not in the higher paid specialties. So we looked at that and, it turned out to be true. OBG has a lot of women, actually plastic surgery has a decent amount, but some of the things like orthopedics and radiology and urology, which are very highly paid, don't have a lot of women. So we said, could that be the reason? But no, because then when we look within each specialty, there was still a gap between male and female. So then someone suggested, well, maybe it's because more women are working fewer hours. And it's true, according to our research, there are about twice as many women working part-time as men. I think it's 12% versus 24%. But we took out part-time when we looked at the pay gap. So that's actually not a factor, whether somebody is working part-time or not. And another thing we looked at was employment versus self-employment, because self-employment continues to pay better than employment. And there are fewer women who are self-employed than males. Turned out that was not the factor. Now, all of these are contributing factors, but they're not the factor. And when you start getting down to it, then it looks like, well, there is some bias there, or there is bias, and you just can't take that out as a factor. There's other things that add to it, but that's definitely something. So, and I talked to a few experts in healthcare and looking at their insights, like, why is this so? Why is there still some bias? Why is all this happening? So people have different theories. One that was interesting, some people are saying that women don't negotiate as strongly or as much as men do. And that is a fact. I think some studies said that men get offered a salary or an income, and they say, no, what else can you do for me? And this study showed that most women say, yes, okay, and they take it. And so that has something to do with it. Now, that may be a tool. Better negotiating skills may be a tool, but that's not the reason. Just like, there's the old saying that an aspirin may cure a headache, but that doesn't mean a headache is caused by lack of aspirin. And so same thing with negotiation. I mean, better skills can help, but they're not really what's causing this whole thing. And I did speak to one woman who I was saying, how did this all get started? So she says, well, in the old days, and we're talking about old days, in the whatever it may have been. I don't know if younger listeners are familiar with the phrase pin money, women working for pin money. And that was like back in the, I guess, 50s or 60s, and women didn't really work, but everybody sewed their own clothes and sewed draperies. And so when they started working, it was just assumed that the man made the salary, and women were just working to get a little extra pin money so they could buy a few more pins for their sewing. And so it was considered okay way back then to pay women less. And that attitude just sort of kind of lasted. It just, it started that way and it lasted. So even though women now have the same responsible, important positions as men, there's still that old attitude that kind of didn't disappear.
When you talk about how you have isolated these factors that many would say have contributed, such as working part-time or being an employee versus self-employment, and then even taking those into account, still finding that the discrepancy is there, it is pretty shocking to me, because And I would say that a lot of women would probably say it's not shocking. But what is amazing is that in healthcare, unlike some other fields, I mean, our revenue is basically determined by productivity, whether, billing an insurance company, the government, whatever it is. And it's gender irrelevant. If you do something, you get paid for that, bit of work. Now, that doesn't always translate to the job in terms of whether you're employed by an academic center or whatever, and your salary is determined by how you negotiate. But it's just unbelievable that it still is happening, that there is a gap that persists when you account for all these factors. And to, even the people in charge now, even if there are a large percentage still are men who may be, in charge of hiring people. I mean, I got to think that they're not part of that generation that believes in, the pin money thing. I mean, that was, like you said, many years ago. The people in charge now have to be beyond it. And to me, like I said, it's stunning to see it, in black and white after you guys have done the analysis that it still exists. So it's something that we really need to improve on in medicine and in most fields. But it's troubling that this still exists when you account for that. But let's go a little bit in general, talking about your methodology, because you talked a little bit about how you accounted for these different variations. So tell me a little bit about the demographics of the survey.
The demographics of the survey, we had, I think it was over 20,000 physicians who responded. And basically, we have a market research and analysis department. And so they recruit for responses. And I mean, they are real sticklers for accuracy and for correct data and trying to get physicians in the right proportion. And so the fielding of the survey takes place over something like 8 weeks. And it's a huge project that takes place annually.
Okay. And you get an accurate representation, like you're saying, of people in the percentages of, primary care versus number of cardiologists versus number of people in Wisconsin, stuff like that, right?
Well, that's definitely for the specialists. As far as the geography, there are some states out in the West that might be less represented, but overall, yes, we have a good proportion.
Okay, so one of the things that in just kind of informal conversations with my colleagues and then seeing some of it discussed on social media is that people tend to be a little bit critical of these surveys. And I guess the question is, there's a few different companies out there that do it, you guys, and then some companies that actually charge for access to the surveys. And so I guess and there's some variation in the data, particularly when we talk about salary. How would you account for that?
Yes, well, so different people who do these surveys have different methodologies and different audiences. And just parenthetically, I'd say if you're looking at any survey, check the methodology and see if this is the one that you feel talks to you or the one that you would consider the data is really most what you're looking for. So for example, and just, not naming anything, but just giving examples, one large survey that's out there is put out by physician recruiters, and they show salaries that are being offered by employers. So their information is a little more geared toward hospitals, large groups, salaries offered or what they're looking for, as opposed to what people take. There's another survey that has a link that anyone interested can click on and provide data. So they have a different pool of respondents. And then there are surveys that use metadata. So they are not conducting a survey themselves, but they're using data from different sources and kind of putting it together. So the thing is, you just have so many methodologies. And I realize that's confusing for people, like, why does this say this? Why does that say that? And most people are not that interested or kind of able to really sort through the methodologies. But all I can say is that's why results differ. And so that's why it's good for companies, as we are very transparent with our data and look at the methodology and then you make a decision.
Right. No, I think it's like I said before, it's a very valuable service you provide, and particularly having free access to this. And I think your survey tends to speak to the physicians themselves, as opposed to, like you were saying, more of the employer or the group model. So let's go into a little bit about. So you mentioned, the overall rise in salaries over the last few years. Has it just been kind of more in terms of the salary rise is kind of tracking inflation, or is it above inflation?
Yeah, I think inflation and healthcare costs and salaries are all, not that they're unrelated, of course they are, but they sort of aren't. There are just so many factors in each different one. For example, healthcare costs, they have to do with what's covered, what are new drugs, what are new technologies. Physician salaries are just one element of healthcare costs. And, other things are that costs go up because we have an aging population. We have more baby boomers, older people using more services. There's greater intensity of care. So the services, it may not be just an X-ray, it could be an MRI. Some people say that obesity is a factor. I mean, there's many factors leading to all the costs. And so they've all been going up at different rates. Some have similar factors and some don't.
Yeah, I guess my point with that is just that when you talk to physicians of a little bit older generation who have talked about more of the days of medicine before the high penetration of managed care, things like that, they seem to have, and again, this is anecdotally, but they seem to recall their salaries were not too dissimilar from what we are currently being paid, and yet, purchasing power back then was better. And on the flip side, like you were talking about, healthcare costs for everyone, we're all consumers of healthcare, have been rising significantly faster than inflation. Yet I don't think physician salaries have tracked that. They, like you said, physician salaries are only one component of healthcare costs, and we really like to harp on that because doctors seem to bear the brunt of blame for that. But it's really a small factor in the overall dollar cost of healthcare. Anyway, my point was that I think physician salaries, while they are rising, are kind of more tracking inflation rather than the overall cost of healthcare. Because as physicians, we feel it too when we are paying for our own insurance or co-pays, things like that.
But one thing I would mention is that physician salaries are still good compared to what salaries are in the general public. And when we first started doing this survey many years ago, we had a couple questions in there. What would you be if you weren't a physician? Or if you'd rather be something else, what would it be? And people put in, the top ones were lawyer, professor or teacher. Some had writer. They had all kinds of different things. But these days, if you go to the lawyer's website, they hate their jobs. They're making no money. Everybody writes their own bills. And then you go to, banker and teachers and everything else. I mean, physician is still relatively a great job, not just for the income, but doing something wonderful for society, something important. Not every occupation can say that.
Absolutely. Yeah. It's definitely not all doom and gloom. There's a lot of positive aspects to this. And I think sometimes we do get bogged down in some of the negatives. So you're absolutely right. A lot of traditionally, safe and respected professions have over the last decade or so have suffered kind of a much worse fate than physicians have. So I would agree with that. And particularly, like you talk about the lawyers, I know a lot of lawyers have been having issues with job prospects and things like that, particularly those who didn't come out of the top 10 law schools. So yeah. I think we're still in good shape as physicians, and I still wouldn't discourage people from going into it. So let's get into a little bit about the the debt and net worth survey. I think this one was a very interesting point. And like I said, it caused some conversation on my Facebook group. There was one of the points that I think was very interesting was that you had a survey of what physicians' net worth would be, and by age breakdown. And one of the things that caused a little bit of consternation was that about 25% of physicians at age 65 had net worth of less than $1 million. And that just was shocking, because you assume, and again, that I assume that the physician at age 65 has generally had a number of years of high income earning ability. Now, obviously there's some physicians who started late career, and there's some physicians who've had extraordinary life events and things like that. But it just still seems surprising that physicians have not been able to build up a what would be expected kind of net worth by age 65 for someone in a high income field. Do you have any thoughts about what that would be?
Yes, I do. So interestingly, that is the norm. That's the norm for everybody. I've worked in different professions and been a financial writer, and have taken the courses to be a certified financial planner. And I see this all over. Nobody pays attention to their savings and to the retirement. Well, first of all, just to step back for a moment. So one good thing, 76% of physicians had a net worth of over $1 million, and 19% had a net worth over $5 million. So that's really a pretty good picture. But when you talk about people not being able to save money, it also shows in our survey up until age 50, some huge percentages are still paying off school loans. So they don't have money that they can be putting away. And another thing, and this is not just physicians, it's all professionals and kind of everybody, people don't do what is the best thing to do, which is to start saving early so that you have the benefit of interest compounding. People kind of have heard it, but they don't do it. And I think society in general is just really unaware of personal finance and what's involved. For example, right now in 2018, only 17 states require that in high school there are any courses on personal finance. And when you look at our physician survey, debt and wealth, 33% have no budget. They don't have a budget sense. 48% have sort of a mental budget. And some of our financial advisors have said, a mental budget is no budget. So people kind of have an idea that they should be saving, but they don't make it concrete. They don't figure out what it should be, and they just don't pay attention to it. And I'm not saying not coming down on doctors. This is like everybody in America.
Yeah, no, it's true. It's true. I think, and I am coming down on doctors a little bit on this part, because, most people, like we had talked earlier, they don't have the room financially, because you have to spend a certain amount just to function and live in this society. So obviously everyone could save a little bit more, but physicians generally have a little bit more room. And that's one of the reasons for this podcast and other physician financial blogs, is to help educate that, because we haven't, no one really receives adequate personal finance training. That's the truth. And so, it's surprising but not shocking that there is this number of physicians who haven't been able to accumulate what we would expect them to. Now, like you said, that's probably true of everyone, but I hopefully we can reverse that. And one of the things I noticed on your survey actually was that the 2018 survey said that 43% of physicians are claiming to live at or live below their means. And just 3 years ago, only about 22 or 25% did. So hopefully we're starting to see some reversal of that trend, because it seems to be a little bit more available financial education now. Again, you still have to seek it out. But it seems to be there a little bit now, that whereas, 10, 15 years ago, it was definitely tougher to get. So hopefully physicians are starting to do better than that. And
I think they are. And, sorry. You can go ahead.
No, please go ahead. Continue. Yeah.
I was just going to say, and some of the factors as far as living below their means, first of all, a lot has happened in recent years between EHRs and quality reporting and things that people don't like doing that are really onerous for physicians. And so a lot more people are thinking of retirement early. Or they're thinking of it sooner than they would have. Once people actually start thinking of a concrete retirement date, they start thinking of saving more money. And I think that might be a factor. And there's burnout and healthcare. The cost of healthcare is rising. People are expecting that payers are going to want to lower the payments to physicians. So I think that saving for the future is a lot more in physicians' consciousness and perhaps more important than it was in the past.
I think that's a very good point. I think you're absolutely right. And I can see that just amongst the social media groups that I interact with. There's a lot of physicians and the numbers continue to grow rapidly who are interested in discussing these topics. And I think you hit the nail on the head. A lot of it is, a factor of the administrative burden that they suffer at their jobs, the EHR. All these things have started them thinking about retirement much, much earlier than I think a lot of physicians would have anticipated when they first started medical school. So you absolutely bring a good point, and it does tend to then focus them into getting down into the numbers and things like that. So when we talk about getting into the numbers, though, so it's interesting because one of the other percentages that kind of struck me was that 32% of physicians, according to your survey, put nothing into taxable accounts. So, we all are taught, okay, contribute to your 401k or your IRAs, things like that. But for the most part, and your survey kind of would verify this, is that most physicians now are employed, and they don't really have much room in those two baskets. Whereas self-employed physicians could put much more into tax-deferred accounts. Most employed physicians have a very limited amount. They have their 401k, perhaps their spouse's 401k, and then IRAs, and then whatever their employer contributes to it. And so they really need to start thinking more about putting into their taxable accounts. But it doesn't seem like a lot of them are doing it, and only about 20% are putting more than $2,000 or more into these accounts. So this just it was one of the numbers I think that really I looked at it. I'm like, wow, this is something that physicians really have to understand, that you're not going to get there just by retirement accounts alone. But I think this also talks to a little bit about that most physicians, like you mentioned before, especially those under 50, are still paying off loans. And student loans, and mortgages are still there, but student loans, and that number, the amount of student loan debt continues to increase. So, yeah, I don't really know that I have a question per se on that part. I just I thought that was a statistic that I think physicians really need to get moving on. But
I think you're right on that, because I think that phenomenon has to do with the fact that people just are not aware of and don't think so much about finance. And so I think for a lot of people who are maxing out their, tax deferred accounts, they're saying, I'm doing great, I'm putting the maximum in. And they're just thinking, kind of patting themselves on the back for doing that, and haven't really run numbers to recognize, like, this isn't going to do it for me. So they think they're doing okay, but they need more awareness of what they really want. I think it's good to even meet with a financial planner, even if you only go once in your young life, and just kind of get a sense of what your target should be and help you get on the path moving forward.
Absolutely. I think that's very good advice. You need to approach this. My last podcast guest is a pretty famous physician, turned financial author. And that's one of the things that he says, is that, you need to approach finance much the way you would in terms of treating a patient. You need to approach it in a scientific manner, look at the numbers and do some analysis. And only then will you really be able to understand where you need to go. So I think what you said is very good advice. So let's, one of the concerns that I think doctors have about surveys such as yours, the accessibility of the Medscape survey it's ubiquitous. You can get out on the internet and find out, pretty good specificity what kind of salaries physicians are making, and so some doctors are worried about how that will then be taken into. They don't like to discuss these numbers in public, and they don't like to. They think it'll be used against them by patients, by insurance companies, the government, payers. What would you say to that?
Well, I'd say as far as people being concerned about their personal data, I mean, the surveys are confidential. We don't provide data to anybody. I understand in this day and age, everybody's worried about the overall use of data, but ours are confidential. We don't share private information. Are you talking about just in general people should
Yeah,
not
I think
have an idea what
right.
position
So let's say one of your, I think you mentioned plastic surgeons. I think the number was like 500,000. Let's just use that as a salary. I think people are worried, and to me, it seems a bit. A bit unnecessary because this, like you said, this data is out there. It's not really your data doesn't make it significantly different. In the day and age that we live in now, data is available. And so I think it's somewhat of an irrational fear that, improving overall transparency is somehow going to be a negative to physicians as a whole. I think that's their concern. I'm not really sure how to alleviate that because, to be honest, transparency is one of the things that helps us narrow issues such as the gender gap, or helps us understand that company A is paying this to their employees, physicians, versus company B. So I guess I would just say that I feel like it's a relatively irrational fear. The agencies that will particularly use this in a way to to talk about physicians earning too much, they're already going to do that. I don't think this is going to change that. So I guess that was.
Yeah, I would say that I mean, on the one hand, that horse has left the barn already.
Exactly.
And like many things in society, I wish it weren't that way, but that's how it is. So there's no going back. But I see a point in a certain way. We did an article on Medscape a couple months earlier. It was written by a physician, America's love-hate relationship with doctors. And so on the one hand, physicians are among the most admired profession. I mean, usually they're number one. And on the other hand, there's resentment from some people, some patients, because of high salaries. And so there's kind of a mixed reaction to it. And so not just patients, but, I can understand why people are worried when news of these high salaries gets out there. But I don't know what you can do about it other than, which is a good point, our survey didn't factor in costs. I mean, there are some specialties where the malpractice rates are just through the roof. And then there are costs of EHR, and there's costs of paying for staff, and there's costs of so many different things. And as a matter of fact, we're considering in future survey reports to start asking about some costs and get a sense of, like, yes, here's this gigantic gross that's coming in, but what are you actually taking home? There's a big difference. And I think that'll be very interesting.
Yeah, I think that's a good point. And I also think, that kind of actually transitions well to my next question, is about what are the future directions that you're going to take this survey in?
Well, I think that would be one of them, just to kind of get an idea, taxes and gross. That may end up being a different report. Might be some kind of a cost and expenses report compared to overall salary. I think one thing we might do as far as asking about assets is look specifically at the cost of a house, because it's now factored into people's assets and net worth. But on the other hand, it's a use asset. It's not an investable asset. And so it may have some bearing on what their financial picture actually is. So that might be something we consider asking.
Good, good. Okay. One of the other things that my suggestion would be to perhaps include, especially in terms of salary and compensation, compare that to maybe the number of hours, or in terms of someone who's a trauma surgeon may be working a 80-hour week, whereas someone who's in a different field may be working 35 or 40 hours a week, and so some of the compensation issues, even though the numbers may be comparable, the amount of hours spent working is not quite so comparable. So and I think
that's a great idea. That's a very good idea.
Yeah, and I just think that would also alleviate more concerns, because like you were saying, taking into account malpractice and opportunity costs for physicians, and that information going out to the general public, I think that would help them understand that, hey, your physician is at the hospital 80 hours a week, so it's not the same as working a 40-hour week. But yeah, I like the work that you guys are doing in Medscape, and I want to say thank you for coming on this podcast. And I'm going to put a link to the in the show notes to both surveys, the compensation and the wealth and the debt and net worth survey. So thank you for coming on this podcast.
Oh, thank you so much. It was fun. I thought your questions were great, and we covered a lot of good information. So thank you for having me.
I want to thank Lesley Kane from Medscape for being my guest today on the Dr. Money Matters podcast. And I wanted to ask you, the audience, what you thought. What is your salary trends been recently? What do you see physician salaries doing in the future? There is a shortage of physicians. Although many, physicians are looking to retire early, and they're concerned about the threats from non-physician providers or insurance companies or government intervention. There is going to be a shortage of physicians, at least for the foreseeable future. And normally, in strict economic terms, that should put us in a good bargaining position. But it doesn't feel that way. What do you think? Where do you see areas that physicians can help improve their salaries, particularly those in the non-procedural fields, such as primary care, family medicine, pediatrics, internal medicine? Where do you see your salaries going in the future? I encourage you to join the Dr. Money Matters Facebook group, and we'll continue the discussion there. Thanks for listening. Thanks for joining us on another episode of Dr. Money Matters. If this is the first episode you have heard, I appreciate you taking the time out and listening, and encourage you to listen to our past episodes. I would also appreciate you leaving me a positive review on Apple Podcasts, and also recommend you join our Facebook group, where we have ongoing discussions about this and other topics in order to help each other reach our financial goals. Finally, I encourage you to subscribe to our email list, and also to subscribe to the podcast itself on the various podcast app that you use, in order to be kept aware when the latest episode comes out. More episodes of this podcast are available at www.drmoneymatters.com and on Apple Podcasts, Google Play, Stitcher, Spotify, or wherever you listen to your podcasts. Audio versions are also available on YouTube and Facebook, and you can follow me on Twitter at Dr. Money Matters, or on Facebook or Instagram at Dr. Money Matters, all spelled out. Thanks for listening, and if you get a chance, please leave a positive review for this podcast, as it helps move the podcast up the rankings on iTunes and gets it exposed to a wider audience. Thanks for listening once again, and stay tuned for another episode coming soon.